Welcome to this special episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, as we know that on the 18th and 19th of June, CINI 2022 is being organized and the focus is on women's health. So today we are talking to Dr. Reena Khurana, who's a clinical instructor and an endocrinologist. And today she'll be talking about South Asian women. Why are they more prone to diabetes postpartum, diabetes in pregnancy? So what all we all need to know. Let's get over to her and ask her some good questions. Dr. Reena, good evening. Welcome to the program.
Thank you.
How are you?
I'm good. How are you?
I'm doing great. Thank you very much. So, a little bit about yourself. You're an endocrinologist. So, how did your interest towards this side come forward?
Well, I've been an endocrinologist in Surrey since 2008.
Mm-hmm.
Since I started, I've been working at the Diabetes and Pregnancy Clinic. We see patients with gestational diabetes, which is diabetes diagnosed in pregnancy. We see patients with type 1 diabetes and type 2 diabetes, and we follow them throughout the pregnancy. So I already have an interest in seeing these patients in my clinic. But what happens after is they leave and we give them a test to check for diabetes after because they're high risk for diabetes after. But we don't know what happens after they leave until they come back, perhaps for the next pregnancy.
Okay. So, why is it that diabetes, especially in South Asian women, they're more prone to it? Is it just because of our health style, the way we are eating, or the lifestyle changes which we need to incorporate? We're not bringing those.
I think it's multifactorial. There's many reasons why South Asian women have a higher risk. There's definitely the genetic risk. South Asians have a high risk of diabetes. Secondly, of course, it's diet plays an issue, right? The South Asian diet can be very healthy. Don't get me wrong, but there is a lot of carbohydrates and for example, roti and rice and the choices that people make to eat in their regular diet. So we do teach them that in the clinic. There's also lifestyle, right? They're not as active as they would be, let's say, maybe in India or back in the day when people were more active and they were doing more exercise or more activities. So patients are not burning the calories like they used to. And also our lifestyle in the Western world is very sedentary. So I think there's a lot of reasons why women with who are South Asian do get diabetes.
So, when you see the patients, what are the major symptoms that are coming forward which you observe in them? And in this clinic where you work, what kind of support is provided to them?
Well, a lot of these women don't have symptoms of diabetes. What happens is between 24 and 28 weeks of the pregnancy, all women should be screened for gestation diabetes. The rate of gestation diabetes is about 16 to 20% in pregnancies. It's actually a bit probably higher in our population, of course. And so they come in and they do what we call an oral glucose tolerance test, where it's this orange drink and you drink it and you check the sugars when you fasting 1 hour and 2 hours after. And if it's above a certain level, then you're referred to the clinic for diabetes in pregnancy. Because of COVID, we do a hybrid between in-person and virtual. So the patients come to the clinic, they pick up a package. We have videos, in Hindi and English that they can watch. Then they read the material, they get an appointment with a nurse or dietitian, they go through it over the phone. And then they come for the first time to meet myself and the clinicians there. And, I quote them, there's about a 60% chance of them requiring insulin in the pregnancy. We have higher risks of insulin in our clinic just because of the population that we serve. But we really focus on diet and lifestyle first, because if you don't focus on the diet and lifestyle first, then you're going to put them on insulin. The sugars are still going to be high, right? And some women, despite being very good with their diet and lifestyle, these women work extremely hard. They check their sugars 6 times a day, right? It's expensive. It's more like it costs money to do this for them and costs time for them to do this, right? And maybe they already have children, maybe they're very busy and they're doing that. So I applaud these women for working so hard. And then we tell them, we say, this is how you should do this with your diet. And they do very well. And despite all those things, sometimes their sugars are still high. And I tell them it's not their fault. It's the pregnancy. It's your placenta is not able to, your pancreas is not able to deal with the high sugars. It's not able to produce enough insulin. So they need insulin. So we do start insulin in some of those patients, and they do very well. In fact, in our clinic, we showed, even though we switched from in person to virtual during COVID, there was no increased risk of complications from gestation diabetes, which was amazing. So, our clinic, we know, is very safe, a safe place for women to go to. And we also provide a lot of support. Financially, we have social work. We also have connections to the other maternal and fetal medicine, internal medicine, and even reproductive mental health as well. So our clinic is very holistic in that way.
So, Dr. Khurana, if you could tell us, give some recommendations while you are talking about this issue of gestational diabetes. As far as diet is concerned, what is your recommendation to expecting mothers? What they should, take care of more when they are in this phase?
Well, they should, a couple of things. They should look at their weight gain. A lot of women gain too much weight in their pregnancy. So you should know what your body mass index or BMI is. It's kind of an estimate of what your weight is proportion to your height. And if it's really high, then you need to gain less weight than you would if you had a normal BMI. So this is something they should discuss with their family doctors or their obstetricians, because they will be calculating their BMI, and then there are certain guidelines of how much weight they should gain. So that's number one. Number two, they obviously should generally follow a healthy diet even before they develop diabetes in pregnancy. So they should have 3 meals a day, snacks in between, including at bedtime. Try to avoid sweets and excessive carbohydrates. For the South Asian diet, there's a lot of rice and roti. So they should try to switch to whole wheat flour or chana flour. And rice, they should keep it less than a cup or switch to brown rice. So there's a few things we would recommend in general for all women, no matter whether whether they have diabetes or not. Yes.
So, when it comes to lifestyle changes, CINI 2022 and Dr. Arun Garg has been focusing on integrative health. That's a major emphasis which he has brought forward even in the previous conferences. So, how important is this concept of integrative health, which is coming forward in a big way? How can that impact and how can it be beneficial for the patients as well as the medical professionals?
Well, I think in diabetes, we're probably more ahead of the game than many other chronic conditions, in that we do have very multidisciplinary way of dealing with diabetes. It's not just the physician, it's the nurses, the dietitians, it's the social worker. But I totally agree with thinking, even putting a more holistic type of medicine in diabetes care, because diabetes is not just the disease of a high sugar. It's a disease of your whole body, because diabetes can cause many complications in the eyes, in the nerves, in your kidneys. You have a high risk of diabetes and stroke. So we really have to develop a holistic approach with dealing with diabetes. And we also have to, the patients, it is stressful having diabetes. It does impact their health. It changes the way they live. And so there's a mental health component for diabetes. We also need to emphasize lifestyle for diabetes, being active and eating healthy and that type of thing. So for diabetes, I think that integrative or holistic approach is very beneficial for diabetes.
And Dr. Khurana, what do you feel, despite all this information that is going out, people are becoming more aware, but despite that, we are finding that cases are on the rise. Why do you feel that way? Because, the kind of services, like, for example, you are saying you are providing by your clinic. Similarly, there are many other institutions which are doing commendable work. So where do you feel those challenges are which need to be surmounted?
Well, I mean, with our clinic, what we're going to be presenting today is specifically about women with gestational diabetes who give birth, and that usually, diabetes is cured by then, right? Once you deliver the baby and you have gestational diabetes, it's gone, right? But these women are high risk for developing diabetes. once their child is 16, they have a 40% chance of having diabetes. That's a really high risk, okay? And put it, they're also, if they're South Asian, that's going to be even a higher risk. So how do we prevent these women from developing diabetes? What
Right.
our project is, we'll be presenting to on the in a week or so, is we're looking at how we can help these women overcome the barriers of screening and preventing diabetes. Can you imagine you just had a baby and you come home and you have to take care of your baby, and some of them still have to take care of their family and their children and their extended family. They're very busy. They don't have time to take care of themselves, right? And we really want these women to be taking care of themselves because we want to reduce the risk of diabetes and having a chronic illness because that impacts the whole family.
Right.
It's not just about the woman, it's about her baby and it's her whole family, right? So we're looking at how we can help these women and screen more for diabetes and prevent diabetes. But in general, I think the risk of diabetes is higher because we're screening more. Our diet is not as healthy as it used to be. We're not as active as we used to be. Canada's, full of different cultures, Filipinos, South Asians, Asians, like there, we have many different ethnic groups with a higher risk of diabetes. So it's just a big tsunami that's coming in, right? People are living longer. The more longer you're going to live, the more conditions you're going to get. But we really, and I think we're, as a society, we need to focus on prevention of diabetes.
Right.
I mean, I can help treat diabetes, but how can we prevent you from having diabetes? Is following a healthy diet, being lifestyle, and helping and supporting these women who have diabetes after birth, helping them reduce their risk of diabetes. I mean, really, diabetes for them, just getting this in diabetes is, men don't get this, but women get this alert that they're at risk for diabetes. So if we know these women are alert, we need to help them at least delay the progress or prevent the diabetes.
So, in this conference, what you're speaking on is this particular topic, that after birth, how they should deal. So, any recommendations that, of course, I would recommend everyone to listen to your speech on that particular day, 18th or 19th, when you're going to present this paper. But today, if you could just give us a trailer of what your recommendations would be to those women.
Well, we're still in the beginning parts of our project. We're still in the exploratory phase.
Right.
But what we do expect, what we're going to do is we're going to conduct interviews, focus groups, surveys to find out because I can tell you what I think the women are
Right.
are going through. I don't know. I'm not a patient. I've never had gestational diabetes. I don't.
Right.
I cannot speak for them. So I want to hear from the patients themselves about what their risks are, what their barriers are. But from what I can tell, what patients have told me, it's financial, right? It's access to healthy food. And as you know, with inflation, food is getting more expensive, right? Yeah. And for example, access to getting help with taking care of their child. I mean, and go access to walking and exercise when it's raining like that. Women are not going to go work out or go for an exercise. So, how can we help these women, give them time to be able to eat healthy and exercise? And also, I think we need to help these women with the families. Also, need to help these women educate. We need to educate families about their mothers and wives who have diabetes to help them. Because once the woman is knowledgeable about diabetes, that woman, a lot of women do cook in the family just the way it is sometimes. They can plan very healthy meals, and this would help reduce the risk of diabetes in the whole family. And I think that's the holistic approach that we're looking for in this project. So
Right.
yeah, we don't have any recommendations other than the usual recommendations that I've just said.
Right. And Dr. Khurana, what role does stress play in all this?
Oh, stress plays a huge part. A lot of people will come in and they'll say they're convinced their diabetes is because they had a stressful event, like a death in the family or a stressful job. And when you're stressed, your hormones, your adrenaline, your cortisol go up, and that actually releases sugar, and that increases your sugar. And in the setting of someone who has insulin resistance, that can help precipitate diabetes, right? So definitely stress plays a role. And I think in our generally our lives are very stressful. So how can we help people, our patients, help reduce their stress? So I always tell patients to look into mindfulness, into meditation, counseling, that sort of thing. Go for a walk, exercise, nature. That just going for a walk actually reduces your cortisol levels. So definitely stress plays a part, but we can help our patients and they can help themselves reduce that stress.
And finally, your clinic, if somebody wants to come over there, it has to be through a family physician, or they can just come there directly?
No, any specialist you want to see has to have a referral from another doctor.
Right.
Now we do diabetes. So as an endocrinologist, just general in the community, you would have to get a referral from your family doctor, whoever. For the
Okay.
diabetes in pregnancy, you're pregnant. So either the family doctor or the obstetrician or the person, whoever's their midwife, will refer you to our clinic and you'll be seen in no time shortly.
Okay. And anything in conclusion, Dr. Khurana, you would like to add?
No, thank you very much. I look forward to seeing all the presentations and
Absolutely.
receiving feedback about our project. Thank you.
Wonderful. Thank you very much for your time. It was a pleasure talking to you, and we hope from this short talk that we have had, our viewers will be getting some good knowledge and they will start working on it. And of course, if they want to meet you, they can go to their family physician and get recommended and meet you for that purpose. Thank you very much for your time.
Thank you very much.
Thank you. ਸੋ ਇਹ ਸਨ ਡਾਕਟਰ ਰੀਨਾ ਖੁਰਾਨਾ ਐਂਡੋਕ੍ਰਿਨੋਲੋਜਿਸਟ, ਜਿਨ੍ਹਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਖਾਸ ਤੌਰ 'ਤੇ ਜਿਹੜੀ ਐਕਸਪੈਕਟੈਂਟ ਮਦਰਸ ਹੈਗੀਆਂ ਨੇ ਉਹਨਾਂ ਦੇ ਬਾਰੇ ਜੈਸਟੇਸ਼ਨਲ ਡਾਇਬਟੀਜ਼ ਦੀ ਗੱਲ ਕੀਤੀ, ਅਤੇ ਜਿਹੜੀਆਂ ਔਰਤਾਂ ਪ੍ਰੈਗਨੈਂਸੀ ਤੋਂ ਬਾਅਦ, ਬੱਚੇ ਦੇ ਜਨਮ ਤੋਂ ਬਾਅਦ ਜਿਹੜਾ ਹੈਗਾ ਉਸ ਪ੍ਰੋਸੈਸ 'ਚੋਂ ਜਾਂਦੀਆਂ ਨੇ, ਉਹਦੇ ਮੁਤਲਕ ਇਹਨਾਂ ਨੇ ਕਿਹਾ। ਲਾਈਫ ਸਟਾਈਲ ਬਾਰੇ ਗੱਲ ਕੀਤੀ, ਖਾਣ ਪੀਣ ਦੀ ਗੱਲ ਕੀਤੀ, ਸਟ੍ਰੈਸ ਦੇ ਸੰਬੰਧਿਤ ਗੱਲਬਾਤ ਹੋਈ ਹੈਗੀ ਹੈ। ਅਤੇ ਇਹਨਾਂ ਦਾ ਇਹੀ ਕਹਿਣਾ ਹੈ ਕਿ ਜਿਹੜਾ ਸਿਨੀ 2022 ਹੈ ਉਸ ਦੇ ਵਿੱਚ ਜਿਸ ਤਰੀਕੇ ਨਾਲ ਇੰਟੀਗ੍ਰੇਟਿਵ ਅਪਰੋਚ ਜੋ ਅਡੋਪਟ ਕੀਤੀ ਜਾ ਰਹੀ ਹੈ ਹੈਲਥ ਦੀ, that's a very good thing, ਜਿਹਦੇ ਨਾਲ ਕਿ ਇਹ ਵੀ ਰਿਕਮੈਂਡ ਕਰਦੇ ਨੇ ਮੈਡੀਟੇਸ਼ਨ, ਮਾਈਂਡਫੁਲਨੈਸ, ਸਟ੍ਰੈਸ ਤੋਂ ਮੁਕਤ ਰਹੋ, ਚੰਗਾ ਖਾਓ। ਪਰ ਜਿਹੜੇ ਇੰਡੀਕੇਟਰਸ ਨੇ ਜਿਸ ਤਰੀਕੇ ਨਾਲ ਜਿਹੜੇ ਭਾਰੂ ਹੋ ਜਾਂਦੇ ਨੇ ਸਾਊਥ ਏਸ਼ੀਅਨ ਔਰਤਾਂ ਦੇ ਉੱਤੇ, ਉਹਦੇ ਕਾਰਨ ਡਾਇਬਟੀਜ਼ ਜਿਹੜੀ ਹੈਗੀ ਹੈ ਉਹ ਵੱਧ ਰਹੀ ਹੈ, ਅਤੇ ਇਸ ਨੂੰ ਰੋਕਣ ਵਾਸਤੇ ਸਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਹੀ ਕਦਮ ਚੁੱਕਣੇ ਚਾਹੀਦੇ ਨੇ। ਸੋ ਇਸ ਦੇ ਨਾਲ ਹੀ ਕਰਦੇ ਹਾਂ ਜੀ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੀ ਇੱਥੇ ਹੀ ਸਮਾਪਤੀ। ਤੁਹਾਡਾ ਮੇਰਾ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 6 ਵਜੇ ਪੈਸੀਫਿਕ ਸਟੈਂਡਰਡ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ। ਸਿਨੀ ਦੇ ਨਾਲ ਅਸੀਂ ਕੈਨੇਡਾ ਇੰਡੀਆ ਨੈਟਵਰਕ ਸੁਸਾਇਟੀ ਨਾਲ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਨਾਲ ਮੰਥ ਦੇ ਸੈਕਿੰਡ ਟਿਊਜ਼ਡੇ ਸਪੈਸ਼ਲ ਪ੍ਰੋਗਰਾਮ ਕਰਿਆ ਕਰਦੇ ਹਾਂ, ਜਿਸ ਵਿੱਚ ਕਿ ਕੋਈ ਨਾ ਕੋਈ ਪ੍ਰੋਫੈਸ਼ਨਲ ਆ ਕੇ ਮੈਡੀਕਲ ਟਰਮਸ ਦੇ ਵਿੱਚ ਇੰਟੀਗ੍ਰੇਟਿਵ ਹੈਲਥ ਬਾਰੇ ਅਸੀਂ ਗੱਲਾਂ ਬਾਤਾਂ ਕਰਦੇ ਹਾਂ। So if you want to be a part of this program, you can contact me at 604-603-7555, or you can email me at harpreetsinghshow@gmail.com. Thank you very much for sparing your valuable time and being a part of this program. Phir mulaqat karange. Have a safe evening, stay healthy and enjoy yourself.